This is a mock interview conducted by ForumIAS Academy at New Delhi. The interview panel includes eminent academicians, retired bureaucrats, and other luminaries. The objective of the program is to acquaint the candidate with the format and expectations of the personality test conducted by UPSC.
May I come?
Come, please come.
Good morning, ma'am. Good morning, sir.
Please sit down.
Thank you, ma'am.
So what is this name Nandagopam? It should be Nandagopalan or Nandagop. Where is it, middle of nowhere?
Nandagopam is actually the foster father of Lord Krishna. It's Nandagopa. So my grandfather actually named me after converting it to Nandagopan.
Either it's Nandagopalan you've heard. Nandagop you have Nandagopan. Okay,
Yes.
good via media, huh?
Yeah, thank you.
All right. So you're a doctor
Yes.
and you have been working since 2 years, huh? 2.5 years. 4 years.
I worked from 2017 to 19 and then as a COVID warrior in 2020. Currently, I'm working as a...
So you were a COVID warrior, but you were still in government that time?
Yes. And currently, I'm working a different job, ma'am.
Currently, the 21, it says you are in the medical officer in the family health center.
Yeah. That was as a COVID warrior. There's a project called COVID Warriors in Kerala during the time of COVID, ma'am.
Okay, what is that?
We were in charge of vaccination, in charge of tracing the patients, following up the patients.
Okay. But 21, after 21, what have you done?
After 21, till this 22 August, I wasn't working. I was preparing for the exam. After that, I joined as medical officer in government's district mental health program in Pathanamthitta district, ma'am. Currently.
And did you lose in seniority?
No, ma'am. It's a contract job.
Oh, but you were regular permanent before that, weren't you?
No. It was also a contract job. COVID warrior is also a contract job, ma'am.
Okay. So tell me, in COVID, what was the mistakes we made? The bad part of our handling of COVID, and what was the good part? Three points on both.
The good part is that, ma'am, we took a decision of preparing for a lockdown initially, so we could reduce the number of deaths in the initial part.
What is that long-term initiative that you're talking about? Be specific.
I'm talking about lockdown. We planned for a lockdown and we completed the lockdown for 21 days, so we could...
Lockdown was sudden, unplanned. Look at the migrants, what happened to them? The people were not prepared at all. There was no planning in the government also. So that lockdown was, and also people say it was much too late.
But from a health perspective, based on the input that we got from WHO...
No, it was much earlier. Instead of 20th March, they should have been doing it in January. But they waited for all those people to come back from China. They waited for Trump to come, everything. Then after, they did it much too late, without preparation. First, we were handling it by clapping hands and lighting candles, right?
No, ma'am, but based on the data that we got, initially our response was swift.
Kerala, the students from China, they came back long back. When did they come back?
First case came back in January.
Yeah, so January was the time when we should have done the lockdown or use that period for preparation.
Yes, ma'am. The first major cases came in March, all of the country.
In January they came, it was all over the newspapers.
It was the first case, ma'am, but...
you don't wait for 2,000 cases to come and then you do a lockdown and suddenly do it without any planning.
But the thing was, we initially took COVID for like another flu. We didn't know the intensity or how the COVID...
we knew because it came to us much later than other countries. We knew what was happening in China. We knew what was happening elsewhere. Of course we knew.
But maybe we weren't enough prepared about the spread in our country, ma'am.
So I asked you the pros and cons, both. You don't have to... What are the minus, what are the plus? There are always two sides to a picture.
The minus was that, ma'am, in Kerala, especially in some states, the number of deaths were kept lower in order to not spread the panic in some areas.
That's the minus, that gets kept low. Okay.
Yes, and secondly, maybe we weren't able to provide vaccines for everyone as quickly as we wanted, maybe. And third, we could have maybe prepared well in advance for the R&D and all, for vaccines and other medicines, ma'am. And the positives, I would say, if we hadn't...
This was positive. Negative, that you had a good vaccination program.
We didn't have the proper R&D for...
But you said good vaccination program kept the deaths low. That's all negatives.
If we had a vaccination program, maybe we could have sequenced the virus earlier. Maybe that's...
All right. Yeah. Now, you have an interest in specially able, right?
Yes.
So, do you think that specially able children should be put in mainstream schools or in special schools? and why?
I think based on the level of disability, or they can be put in mainstream schools also, but they can be
They'll be poked fun at right from the beginning. They'll develop a complex and they will not be able to keep pace.
But they can have special educators maybe in the mainstream schools itself for them, for providing attention to them. If you are part of the group, I think they can overcome that inferiority and they'll feel part of the mainstream group itself. So I think if we can provide special educators to understand the disabilities and to tackle them, I think.
Okay. Now I'll put you in a situation. Have you opted for the foreign service?
Yes, ma'am.
You have. So supposing you are JSMEA and you are handling Iran desk. So you know what has happened with the Iran crisis. Yes. So what would you do? Yesterday's papers carry it. What would you do?
I'd like to have proper diplomatic conversation.
No, diplomatic conversation. There's a specific issue. The issue is a picture of the protester against the government is also pasted there. They say remove it. Would you remove it? Would you keep it there?
I would keep it there.
Why?
I'd like to.
But when anybody is critical of our government, we label them as anti-national, anti-patriotic, out to destroy India. And we are insensitive to Iran and we suddenly become champions of human rights.
I think freedom of speech and expression has to be provided to.
Not in India. That's what the critics say. It only applies to other countries, not to us.
Ma'am, but we are providing freedom of speech, freedom of speech and expression. We are providing space for criticism everywhere. So I think we have to keep it there.
Okay, thank you.
Thank you.
None. So you are a doctor,
yes,
right?
Yes, sir.
There's an allegation that, because of this COVID vaccine, the number of heart attacks have increased. Do you find any merit in this allegation? And if there's a merit, what actually is leading to that heart attack?
Sir, as you rightly pointed out, recently there have been rising instances of young patients having cardiac diseases after maybe after the COVID. But it can be either due to the COVID disease itself or due to the COVID vaccine. We'll have to have much research into that because it is being said that the COVID itself can cause thromboembolic conditions in humans, that is increased clotting incidence. So I think we have to have more investigation, more autopsies being done in such cases. Then we'll have to find a pattern, whether it is because of that. And regarding vaccines, I think we had to have quickly.
I'm sorry to interrupt.
Yes, ma'am.
Because follow-ups are done. How many cases of people having had vaccines show up these problems as compared to people who have contracted the infection? Yes.
Ma'am, recently there has been rise in cases, especially among the elderly, developing neural complications and cardiac complications in my state also. But the thing is that you can't entirely differentiate between whether it's a comorbidity, whether they already have the comorbidity or is it due to the vaccine. And autopsies are not being done on the elderly patients also. So I think we have to prioritize the research, especially in young patients. Then we'll have to find a pattern. And regarding vaccines, I think normally vaccines will take years to develop, but due to the emergency situation, we had to come out with the vaccines to control the pandemic. So maybe we might not have foreseen the consequences of clotting developing.
Suppose tomorrow this allegation is proved to be right. Then what action should be taken?
So maybe we can have a checkup of those who have taken the alleged vaccine. We can check the blood markers for clotting. Maybe you have prothrombin time by which you can determine whether the clotting will surely happen or not. That will be the next step.
Shouldn't it be done earlier before giving the vaccines? Some parallel checks there itself.
We usually when we give the vaccine, we have a questionnaire. We'll ask them whether they have any other comorbidities or not. But the thing is that you usually do not do any genetic checkup of these patients. Sometimes genetic makeup can be entirely different, sir.
You use the word cardiac. What is the difference between heart attack and cardiac arrest?
Heart attack, the generally used term is for myocardial infarction when the blood supply to a part of a heart is being cut off. Cardiac arrest is just the stopping of functioning of heart, maybe due to any other causes. It can happen due to maybe exhaustion, maybe due to any other causes also, sir.
Okay, so since you are from Kerala, I've got a question related to Kerala. Now, Kerala has got the highest literacy rate, right? It also has a dubious record. That highest number of youths joining terror organizations such as ISIS. Why is it happening?
So one thing maybe is that there's a rising unemployment in Kerala because youth in Kerala, like you said, has high literacy rate and high education, but they don't have enough opportunities in Kerala itself. So it is maybe easy to radicalize them. Secondly, with the rise of social media, especially in Kerala, the social media use is very much higher when compared to the national average. So the youth is again trapped into that due to the social media radicalization, sir.
Okay. Did you read the economic condition of Kerala? Now, its GDP growth recovery is a perfect V shape. For past 2 years, it was negative and suddenly positive 12%. What led to this V-shaped recovery?
So Kerala's economy is basically dependent on service sector. We have a booming software sector in Kerala. We have a tourism and hospitality sector. So once the pandemic, even during the pandemic, the software sector wasn't much affected. But once the pandemic receded, our tourism and hospitality sector picked up, especially with the inflow of domestic tourists. And hence, I think we gradually started picking up after COVID, sir.
Okay. Thank you, Nand.
Thank you.
Hello, Anand.
Yes.
Can I call you Nanda?
You can call me Nandan, sir.
Nandan?
Yes.
Okay. Nandan, you were born on Children's Day. So there have been a lot of cases regarding sexual violence against children. So what are we doing enough as a society to protect them?
Personally, from my opinion, no, sir. Because even last week, while I was taking a class in a school with regard to POCSO, one girl child, she was very anxious and she went out of the class immediately. Then when I talked to her personally, she confided to me that she had suffered abuse like 4-5 years back, but her parents had forced her to keep mum on that issue. So I think first we have to sensitize the parents, then we have to provide awareness in the school syllabus and curriculum itself, and then provide awareness to the teachers. So maybe we are not doing enough in that front, sir.
And as a legislation, laws we have to protect them, are they in the right direction? Are we utilizing them right?
So if you're talking about the Protection of Children from Sexual Offences Act or POCSO Act, the first thing is that as the society progresses, the age of consent is now a contentious issue. Many youngsters are having consensual sexual relationship, which can be later termed as sexual harassment cases. Secondly, sir, false cases where the children are being used to target others are also being on the rise. Especially in Kerala, I have read about some cases, sir. So we have to tackle that loopholes. And thirdly, again, we have to provide more awareness to children and parents regarding the issues.
One amendment you want to do to the act?
One amendment? So maybe we have to stick to the 1 month investigation deadline and 6 months.
So talking about POCSO itself, it was recently in news. Have you read it? Regarding the act itself? Yeah. So it was recently in news. Are you aware about what?
Sir, if you're talking about the judicial pronouncements regarding...
So I'll specify it more. Regarding Assam government's utilization of the act for child marriages.
Child marriage, yes, sir, yes.
Yeah.
Yes.
So was it right or wrong?
Sir, if it was a consensual relationship and if they are married now and they are living happily, then there is no point in going back and punishing the culprit, saying that you have done the crime. But moving forward, I think maybe
they can utilize it.
There had to be a synchronization between the Prevention of Child Marriage Act and the POCSO Act in the future, sir. Because if you are defining a minor as one who is below 18 years of age, then it has to be same in all the acts. Otherwise, in the future also there will be confusion.
Okay. My last question to you. This your wife has requested us to ask that if you are not able to clear, then would you be comfortable living under the same roof with a civil servant?
Yes, I would definitely be comfortable living in the same roof. I would be happy with my job. And I'm finding peace with my job, sir.
Okay, thank you.
So, Nandan,
Yes, sir.
what is Mani Pravalam?
Manipravalam is actually the mixture of Malayalam and Sanskrit language, in a sense that they cannot be differentiated. It might feel like Malayalam, but it has Sanskrit in it also.
Other elements in it. Okay. And who is called the Singing Sword of Kerala?
The singer,
Singing Sword of Kerala. Very famous poet from there in Kerala. You have Malayalam language
you're talking
literature.
about Changambura.
No. Okay, read about him. No problem.
Okay, sir.
If I say Subramaniam Bharti, anyway. Subramaniam Bharti. If I say that America doesn't lose war, it loses interest. Would you agree?
Yes, sir. With regard to Afghanistan, I think this point can be applied because it has been waging a war there for more than 20 years. But it hasn't had it hasn't achieved the results that it would have liked to have. So naturally, it withdrew from Afghanistan. So we can say that this point applies there, sir.
Okay, so is it a reliable ally then?
With regard to India, I think, sir, America is a reliable partner. We have had strong relations for the past 50 odd years after our independence. America has helped us.
Since our independence, it was a reliable partner. Are you sure?
There has been ups and downs in the relationship, definitely. But if you talk about the food scarcity we had initially post-independence, the US helped
Food
us.
scarcity, it was like ship-to-mouth situation because of their help. Nothing better than a ship-to-mouth situation.
Yeah, but they provided the technology for green revolution. And recently we have signed a nuclear deal with the US.
Then what about sanctions, CAATSA? And our relationship with Iran?
Yes, CAATSA. America has to prioritize its relationships also, sir. So it has sanctions on.
Okay. So you have opted police services as your second choice. Let me give you a situational question. Suppose you get IPS and now you are, after 7-8 years of service, you are a SP of a district. And you get this phone call that there is a riot situation in your district. You just got to know this. There is a riot situation. Which will be the first 3 phone calls that you will make?
So first, I would inform the DGP of the state regarding the actions that I am going to take. Second, sir, I would have a group conference maybe of all the commissioners in the districts, or commissioners or the assistant commissioners in my district. And thirdly, I would like to call the district collector also to have a synchronized operation in this.
So, okay. Do you think that there should be a cooling off period for judges? And if yes, why? Why not?
Yes, sir, I feel there should be a cooling off period for judges because if judges are given postings immediately after their retirement, the judicial decisions can be affected before in that term. Also, it can taint the public's faith in judiciary if you are giving appointments immediately after the retirement. So there definitely should be a cooling off period, sir.
Okay. Do you think we went wrong while we chose for a nominated governor in our constitution instead of an elected one, appointed governor?
No, sir, I think we didn't go wrong there because governor acts as a link between the state government and the central government. If a governor was an elected one, then there would again be political questions involved in the election of the governor. That if the governor belongs to a different party and the minister belongs to a different party, then there can be difference in opinion.
Governors are doing their work all fine. Everything is hunky-dory, no problem.
Currently, there are issues, sir, in certain states when the governors try to interfere in the workings of the state government, or when the state government never heeds attention to the governor's advices. But so far, in a period of since our independence,
Should we do away with the pleasure doctrine?
No, sir. I think still, if we do away with the pleasure doctrine, there can be issues. There should be permanency.
What is pleasure doctrine?
The pleasure doctrine is that the office of the governor depends on the pleasure of the president.
Okay. Thank you, Nandan. That's all from my side. I'll pass on to the Honorable Chair.